Hello, welcome to the MIT Social Entrepreneurship Alumni Group Zoom event, American Cancer Society, Healthcare Innovation Through Impact Investing. I am Sayuri Sharper, President of SEEG and moderator of today's conversation. Vera Schroeder, SEEG's VP of Programming, will be our co-moderator. Today, we have the opportunity to discuss how impact investing can fit into global nonprofits' mission. Should these nonprofits invest in for-profit businesses in addition to funding research programs? I am pleased to have as our guest, Alice Pompanillo, Managing Director of American Cancer Society's Impact Fund, Bright Edge. This event is a conversation with Alice. I'll start with a set of questions. Then Vera will facilitate asking your questions. You can enter your questions using Zoom's Q&A function at any time. Vera will post them to Alice on your behalf. We'll get to as many questions as we can. Before we get started, I'd like to say a few words about SEEG. So SEEG is organized under MIT Alumni Association. Our mission is to bring together MIT alum and like-minded people to co-create a better world through social entrepreneurship and impact investing. SEEG membership and webinars are open to the public. If you're interested in impact investing or social entrepreneurship, please join our community by going to mit-seeg.mn.co. Now it is my pleasure to introduce Alice Pompanillo. So Alice is an impact innovator, systems level strategist, creator, and convener with over 25 years of experience in life sciences, industry, public policy, and social sector. An expert in rare disease and precision oncology, she focused on disruptive technology adoption and companion diagnostic therapeutic co-development strategies with an eye toward value-based care. In addition to her leadership role at Bright Edge, she serves on the faculty of Harvard, MIT, HST, Sloan Healthcare Venture, and MIT LinQ Catalyst Biomedical Enterprise Formation programs. She holds a Master of Public Policy from Harvard University and a Bachelor of Science in Biology from MIT. She is also a member of SEEG. Please join me in welcoming Alice. Hi, Alice. So let's get started. Please tell us your journey from graduating from MIT to private sector, then to American Cancer Society. How did you come to run their impact fund?
Oh my goodness, Sayuri, it's great to be here. And thank you for the invitation and thank you for convening this amazing community. I'm so glad that within the MIT network, this is a shining light for other individuals looking to get into social enterprise. And it was quite honestly pivotal in my journey towards impact investing. So I thank you, and I thank you on behalf of all of us in SEEG. So as you mentioned, I am an MIT alum. I graduated undergrad course 7 for those MITers on the phone, which is molecular biology, and very quickly realized I was much more interested in the issues surrounding science and technology than the actual science itself. Quickly pivoted to public policy when an amazing advisor, Professor David Page, who was at the Whitehead Institute at the time, said, what is it that you're passionate about? And I had so many questions about the regulatory environment, the research funding environment, and we came to realize that government and public policy had a significant role in what sciences and engineering disciplines programs were supported and how did they operate. And so I quickly pivoted to science and technology policy initially and worked in the Clinton administration on the Human Genome Program, trying to justify to Congress why tax dollars should be paid towards running big experiments. And little did I know that the biotechnology industry was just emerging and blossoming, and quickly found many opportunities back in the Cambridge area to be part of that revolution. So really for the first 25 years of my career, I spent in medicines development, various R&D, commercial strategy, business development roles within companies like Sanofi Genzyme, AstraZeneca, Radius Health. You know, my teams helped to get orphan drug policy passed in many markets. Now that's more of a health policy, but it also had, you know, dramatic implications for economic development and regulatory frameworks for biologics. And in some ways, you know, what I'm hoping to do now with ACS is actually, you know, build a public healthcare marketplace, if you will. But, you know, I like to say, having trained as a biologist and working in biopharma for my first career, I know a bit about making medicines. I know a lot about making money from selling medicines. And sadly, I know too much about helping patients find money to access and afford medicines. And so my journey to American Cancer Society was actually a personal one. My family's been ravaged by cancer in the last 12 years. 14 individual members have fought their own battles, including my mother, whose battle never even was begun because she basically avoided care. She was 62 years old and feared what her costs would be. So that was my moment when I broke out of the medicine cabinet and realized that there was a lot more we could do, you know, than assuming that we could achieve system level change just through product launches. And that was how I came back to MIT. I'm really passionate about solving the biggest problems, deploying the best talent, and mobilizing resources. And MIT Healthcare Ventures and Catalyst Link are phenomenal ways to do that. I'm also a believer in lifelong learning, so I am new to impact investing, but I happen to, you know this ecosystem quite well, and I believe we're at a pivoting point right now within the life sciences where we will need to move from more of a discovery-based approach to a needs-based approach. And so, you know, it is both a professional and a personal journey that brought me to impact investing.
Really sorry to hear about your mom, and I know cancer touches so many of our lives. My mom also was diagnosed with colon cancer, but it was caught early. Her sister passed away from that, so it runs in my family as well. And I'm glad that you're there trying to help us solve some of these problems. And you've really had a distinguished career before joining American Cancer Society. What of your experience do you think is most relevant and will help you run the Bright Edge Impact Fund?
Yeah, and you're so generous and kind because I look at my career almost like a patchwork quilt. You know, I just happened to be at the right place at the right time and was implacably curious, as I mentioned before. You know, so always looking down around the corner and asking why. I honestly think that, you know, to do these types of roles well, we can't be single story people. You know, we really do have to have touch points across the entire value journey of product development, product life cycle. I think we have to have an understanding of the different stakeholders and institutions that are part of, you know, the ecosystem, not only on the innovation side, but also on the investment side. And so, you know, I couldn't do this job if I hadn't had hands-on experience in medicines development. You know, I couldn't do this job if I didn't have, you know, experience in the commercialization and sale and transactions that surround healthcare, and what are the incentives. So I would say that it's, not only the combination, but it's almost the breaks in one's career where you actually generate the most value. Because as you and I just shared, our personal lived experiences make us who we are, and sometimes we bifurcate them too much. And when we are able to take time to really pause and reflect on, what did I learn from that last job? What am I most passionate about? How can I make this world a better place? Are my talents and skills being fully deployed to address the problems that I care most about? So I would almost say it's the, it's the collection of experiences, but the most helpful are those pauses and those breaks in between, so that you can be the driver of how you want these different skill sets and experiences to intersect. And then you're really driving, the path forward.
Wow, such great advice for people that are starting their career and in the middle of their career, to take a pause and to think what is most important to you. Maybe a question more about the organization. So Bright Edge, how does it fit into the ACS organization, and what is kind of its mission to be part of and enhances the overall work of ACS?
Sure, sure. So for those of you who aren't familiar, American Cancer Society is our country's, in the US here, our country's largest and most historical cancer charity. We're the largest non-governmental, non-private funder of cancer research, but we also provide really important patient services like free lodging, free transportation, patient navigation, call centers. So, it runs the full gamut. We are the comprehensive cancer charity of them all cancers, prevention, screening, diagnosis. We have research, education, advocacy, and services. And so our mission is that it is system-wide. It is the entirety of reducing cancer mortality by 40% by 2035. And we will attack cancer from all different angles. It's not limited to just novel, medicines development, drug discovery. It's not limited to public health campaigns. It's not limited to patient services. And so, when you think of healthcare and system level gaps, American Cancer Society happens to have some of the, deepest and unparalleled knowledge about the problem of cancer. When you think of the population science studies that we run, the epidemiologists that we've funded over the years, but also the biologists at a molecular level, we know what are the problems and what are still persistent unmet needs. And in many ways, we are also designers and architects of solutions. So healthcare, at least in the United States, is a public-private nonprofit mashup. And when you think of the American Cancer Society, we are in the business of filling these gaps. And that can be through a nonprofit model, meaning we take charity dollars and we actually operationalize solutions through the programs that we run. When you think of the public sector, American Cancer Society Cancer Action Network is the country's preeminent cancer advocacy organization. We are the reason why the NCI, the NIH's budget increases year on year, because we are advocating for medical research, scientific research. We, were recently the collaborators and authors behind the Enhancing Cancer Research Act, the Henrietta Lacks and Enhancing Cancer Research Act, that was ensuring that underrepresented populations, social, economic, racial, rural, age, are being offered and have access to clinical trials of breakthrough medicines in development. But when you think of the private sector, Bright Edge really represents our ability to engage, interface, but also harness market-based forces to be able to both fuel our mission, but also deliver our mission. And so from that standpoint, it is an emerging extension of the way the society currently delivers and operates on its mission. But I think it's a very exciting place to be, because we have now a level of sophistication and understanding of some of the tools, not only in the impact investing space, but also in the impact innovation space.
That's great. So how is the investment in BrightEdge funded? And what are your metrics as to the success of what you're doing with Impact Fund?
Yeah. So, so today BrightEdge is really at a point of opening its next chapter. So the society had incubated BrightEdge, for the last few years. It was an initial transfer from the balance sheet from prior donor dollars to see whether we would be able to execute on this model, which is to invest alongside traditional leading life science venture capitalists in startup oncology companies in exchange for equity, that we could, pick the right investment opportunities, we could diligence them, we could exit. And so, we are at a point now where we have, and I also would consider BrightEdge to be a startup, a social enterprise in that way too. We have proof of concept and we have a minimally viable product, meaning that we have now done 9 investments. 2 of them have gone public. We have worked across the entire patient journey in terms of diagnostics, screening technologies, therapeutics, even patient navigation and support, digital health companies. And so, we believe that now we have at least an initial track record to be able to go to a donor community and really explain and inspire why BrightEdge would be the next chapter for the American Cancer Society. Because what we're talking about here is really a triple bottom line, right? We are not like some of the other venture philanthropy groups who admirably are all about, a race to a cure, convening enough capital, data, organizations to overcome translational or validation science or funding gaps. What we're really talking about is, yes, we want to accelerate science, and startups play a key role, but we also believe that technology plays a key role in achieving social impact, and there are enterprises there that we can enable, and we can be a catalytic factor. And then, oh, by the way, we also want to achieve more sustainability, and that's sustainability for American Cancer Society as an organization, because BrightEdge was initially born out of a financial resilience objective to diversify our income. But by the way, when you think of, especially coming out of the pandemic, organizations like ours and other nonprofits that provide social services, and the fact that there will be a tsunami of need. Cancer screenings were down by 80%. Research budgets, had to be constricted for a short period of time. And organizations like ours that relied on in-person event-based fundraising were really hit by the pandemic. We are in trouble from a model sustainability, from a system sustainability standpoint, not to mention that healthcare in general is facing its own issues around sustainability. So cancer, if we can create a more sustainable cancer ecosystem, both on the innovation and on the provision side, we will have done a much greater service than just providing financial return for a single nonprofit.
So will you be raising separate funding for this impact fund, or is this going to be kind of allocation for from the American Cancer Society?
Yeah, so in this environment, of course, last year was a tough year for the society. And so we are still waiting for the transfer from the society, but we're confident that will happen. But we do believe that, what we stand for, which is health equity, that everybody can have a chance to prevent, to detect, to survive and thrive, from cancer, that this moment in time of global awakening and sensitization to healthcare disparities, to how fragmented and broken our infrastructure is, to the racial justice movement. You know, we actually we do believe that there is an audience of philanthropists and impact investors who now will prioritize health and will prioritize this model. So yes, we are actively looking for new capital in the form of philanthropic donations. We are working towards, you know, additional functionality and features within BrightEdge to interface better with donor advised funds and with other impact investment vehicles. But today we are actually, as a startup, really excited to welcome, and this is great news, what we would call our founder circle. So just like a startup, friends and family are joining us at this early stage of BrightEdge because they do believe in bringing the impact investment movement to life sciences and healthcare for cancer.
That's great. That's great, Alice. In terms of your investment, what kind of criteria are you using? What type of investment do you want to make to enhance your mission?
Yeah. Well, so we are the Cancer Society, so there needs to be obviously a cancer focus. We are today the fund size is about 34 million, and we invest typically early, so Series A, seed, you know, some B. If the company is not cancer focused or cancer specific, then we have had instances where it's a technology that we would say is cancer wide, meaning every cancer patient might have a need that is currently unmet. And I think that the key here is because the American Cancer Society, given our breadth, given our health equity focus, you know, and also the oncology marketplace, which is very robust, we do not have a shortage of deal flow. So our strategy is really in the selection of what we choose to invest in, and we can be firm in our commitment to impact. So we will identify opportunities based on the needs that we know of and we can validate, but we decide based on return. And that return needs to be both financial, because until cancer is cured, people are going to be calling the American Cancer Society for rides and for lodging, et cetera. So we have to grow, you know, and provide financial return for the society, but it also has to be on mission and impact. And so we currently have the ability to diversify across the portfolio investments that are both, you know, financial, as well as ones where we would play a more catalytic role to drive, you know, more venture dollars and investment and resources towards impact.
So you mentioned deal flow, and I'm sure a lot of the social entrepreneurs who is working on maybe cancer medical research that's tied into, you know, cancer would love to know, how do they get in touch with BrightEdge. So maybe we can talk a little bit about your deal flow. Where does it come in, and how do people get into your pipeline?
Yeah. Well, so as you know, life sciences is a very specialized and technical field, and I'll just speak about the cancer biology side. And today, BrightEdge's portfolio is heavily dominated by cancer therapeutics and diagnostics because it is so specific to cancer. People will say, well, what about infection and inflammation? There's certain mechanisms of action that would be relevant also in cancer. So today we do not do program level funding, meaning if a company would like to pursue cancer and they're looking for resources to run that extra trial, that today is not a fit for BrightEdge. The other piece is that, you know, we really believe also part of our value proposition is bringing a culture of health equity to the investment community. And so we work alongside the leading life science venture firms. We do not lead today, we follow. And that people would say, well, why couldn't you have just been an LP in someone else's fund? Well, this actually allows us to work across multiple leading investors, which is great for our financial objectives. But when you really think about it, you know, another value proposition that ACS and BrightEdge brings is our ability to be the patient-centric innovation partner for those early stage companies. You know, a lot of these startup companies that, you know, 70% of drugs and biologics that are launched by pharma companies are actually licensed in or acquired. And those discovery programs are being overseen by very experienced, you know, management, company management, but also, you know, very financial forward VCs. And so by having BrightEdge as part of those early rounds, we can bring some of that late stage knowledge. We can bring an understanding of patient, provider, payer barriers earlier in product development and really inform, you know, more patient-centric, human-centric design. And so, you know, right now, that is a model that BrightEdge is really proud of. But over time, you know, I think that we realize that works for venture-backed companies. Well, what about public companies where we may be able to be an advisor on ESG integration and other, you know, healthcare metrics? And so BrightEdge today is primarily focused in investing in early stage startup companies focused in oncology, again, science-based, discovery-based, but we would love to diversify over time into other asset classes and partner with different institutional partners where we could be the strategic impact component.
Oh, wow. It's a lot of work ahead of you, Alice.
I love it. It's exciting, but you are right. We are bold, but we attack cancer from all different angles. So this is really no different.
Yeah. So I know that you started your position fairly recently. But maybe can you talk about? I'm not sure if you have made an investment since you joined, or at least kind of what type of company, kind of what do you think are the type of companies you make your next investment, I suppose?
Yeah. So, and you know, the word is out now because BrightEdge was incubated, it was launched, and then it went somewhat dormant during 2020, as we all did, and now we're back out, and you know, the sign says we're open for business. So we are getting lots of really exciting opportunities, but already just in my time here, we've done one follow-on financing for a cell and gene therapy company that we were involved in at the seed round. This is a University of Pennsylvania spin out. We know many of the scientists who are well regarded and respected in the cancer biology space. And so the science is cool. But at the same time, you know, this company's approach is really an in vivo CAR T approach, which many people are so excited about, you know, chimeric antigen receptor technology and it being curative for patients. But the efficacy, you know, and the outcomes are only available to maybe 20 to 40% of patients out there. So there's still huge unmet need. And the jury's out as to how quickly our infrastructure and health systems can adapt to be able to receive, you know, this very intensive cell harvesting, manipulation, and then, you know, transplantation process. And so the idea of making CAR T available to patients without those additional steps to potentially, you know, shorten the patient journey, shorten the institutional journey, reduce costs, you know, that to us is how we would see impact, and we would consider that a win-win, and it would meet all of our investment criteria. So we were part of the oversubscribed A round that was announced a couple of weeks ago. We're actually in the process of closing on a company that is so not traditional for BrightEdge. It is a nuclear medicine platform technology company where we were approached and then eventually validated the problem of medical grade radioisotopes being a constraint, both for patients who were trying to get diagnostics, but also, you know, in radiotherapy and for pharmaceutical development, where radiopharmaceuticals, the NCI has actually estimated that today 5% of clinical trials have radiopharmaceuticals. That number could be 60% in the next 10 years. Not to mention the fact that most molecular biology techniques in cancer research depend on radio labeled reagents. So that's another example of where the company itself may not be cancer specific, or it now is cancer focused, but it is cancer wide. And our enablement for cancer patients to get diagnosed, to have more treatment options, and then, oh, by the way, to enable an entire field of research to blossom, that's another great win for the American Cancer Society.
That's great. So I guess your mission in part is generate return, and that can then fund your further investment and potentially flow back into other works that American Cancer Association does. So looking at kind of your investment cycle, what do you look for in terms of exit?
Yeah, so, our investment horizon is typically 4 to 7 years, although we have been recently more involved in early stage companies because of the science and the relationship that we have with the lead investor. But as you know, life sciences, healthcare, the marketplace has been just phenomenal these last 4 years, even still breaking records during the pandemic in 2020. So we, are just surprised, to be honest, at the ability for companies to move so quickly through development. Part of that is because of advanced scientific approaches to really de-risk programs. Part of it is, just the abundance of capital to really accelerate research. And so it's not uncommon for an oncology company to raise a $75 million, $100 million Series A. The entrepreneurs may not want that, but the money is there. And then on the back end, we are seeing companies go public, even in 2020, prior to initiating clinical trials. We are seeing companies be acquired directly by large drug and device manufacturers because it is so competitive. And then the SPAC, model is TBD, but that presents some additional interesting opportunities for exit. So we have to do some work now as we're pivoting from truly a embryonic startup first time fund to something that is going to think more, holistically about how we can grow initially and then begin to grant back to the society. We would want to have a portfolio management strategy that reflects the ability to do that.
Wow. Alice, I'm so excited for you. This is you're doing a big undertaking, and would love to have another conversation in a year or two and see where you're at. Of course, would love to talk to you more often than that. Besides about your work. Let me now turn over to Vera, who is going to maybe ask her set of questions and also help with getting questions from the audience.
Well,
Vera?
thanks, Sayuri. And Sayuri, you are so humble. You do not take enough credit for convening this amazing group and building this culture of social enterprise among people who either are technologists or working in technical sectors. So again, thank you so much.
Oh, thank you very much for that, Alice.
Yeah.
I agree with Alice. And Alice, it's so inspiring to hear your story, hear about the work that you're doing at Bright Edge. And to our audience, I would ask you to submit all questions you have for Alice in the Q&A section of Zoom, and we will come to them as they are submitted. And we have our first audience question coming in from Hein, who's asking, what is the best way to contact you, Alice, and Bright Edge for a startup?
Yeah, so there's a couple ways. You can contact Bright Edge through our website, brightedgefund.org. That would be one way. I think, a very attractive way is if you are already working with a lead investor, who is one that we've worked with before, that would be an excellent way of getting a hold of us because, again, we share diligence. We have very deep and strong relationships with other investors, and we are, building a community of practice and a group of trusted partners that we invest alongside. So that would be the best way.
And maybe just a follow on for startups that are reaching out, what is the level of detail and information that you like to review as a first get to know you?
Yeah, I mean, typically we will set up just a 30-minute, well, we'll of course look at, their preliminary information and what is their platform, what is their technology, what is their, what is the problem that they're trying to solve, and ourselves, we can quickly understand, is this an opportunity that is actually well served already in the marketplace? Is it, tremendously overfunded? Because we do need either the investors or the entrepreneurs to make the case of why American Cancer Society, Bright Edge should be involved. And I just, believe that there needs to be a scientific and innovation or a market gap that can be clearly articulated. Us funding yet another, offering a Me Too, and sometimes even, I come from the rare disease and precision oncology space, one that is so focused and targeted, those may not always meet our impact and health equity criteria either.
And then maybe a follow-up, I'm very curious. What is the type of problem validation that you do with all of the resources you have available with the American Cancer Society behind you?
Yeah, I mean, we're going through this right now in that we're evaluating an opportunity in the cervical cancer screening space. The actual company and the technology itself is not that novel, but the business model is really novel. And the ability to be almost that last mile technology to serve a population that we have attempted to reach through public health awareness campaigns, through patient navigation, through all of these other things, that would be an example of where the need is almost, shouting from the rooftops. How we validate that is through our own internal domain knowledge and internal expertise, as well as our network. And so one thing I failed to mention is the American Cancer Society has funded over $5 billion in cancer research since its founding. We have contacts and grantees in over 1,100 institutions. 49 Nobel laureates have received ACS funding at some point in their careers, and over 70 NCI designated cancer center directors have affiliation with ACS. So one of the things that we're building right now is a Flex Advisory Network, who will be, at a range of different levels, either opting in to directly support or being on call to advise Bright Edge investment decision making, but also for the portfolio companies that we have, because we may have funded an ACS researcher when they were a postdoc, and now they're a Nobel laureate or they're an ACS research professor at a leading institution, and they are ready to serve on a scientific advisory board or serve on a company board. We are so excited about now engaging our American Cancer Society research community in this new way. And then I'll just kind of add one more piece to that, which is keep in mind that the research is not limited to the lab. So we are also doing systems level research. We're doing community level research. We are doing our own population studies, and we have our own data sciences. So, the opportunities to really reflect the innovation ecosystem through the touch points that Bright Edge can create internally at ACS is really still underdeveloped and quite exciting.
Yeah, that's very exciting. I would love to learn more about BrightEdge or ACS as a value add investor. It's like how do you service your portfolio and future portfolio? It sounds like having an advisory board of Nobel Prize laureates sounds like a very exciting start.
Yeah, no, it is. And look, we can't boil the ocean to make a cup of tea, so we have to start somewhere. And right now, the brand of American Cancer Society actually has intrinsic value. We know that. In fact, we would include in some of our legal negotiations, it would be very important to preserve the brand. For example, because we are a guideline issuing body, we are seen as the convener, the consensus developer for so much, related to cancer in terms of policy, advocacy, and also scientific progress. And so I think that's already just the American Cancer Society participating. People know who we are and what we represent. But then beyond that, I think what I described before about us bringing late stage knowledge to early stage product development, many entrepreneurs want American Cancer Society and BrightEdge in the room because we then enable them to fundraise, but also they like the diversity of perspectives and viewpoints around the table, because think of how many entrepreneurs would love to do the right thing for patients early on, pick an indication, that they know is truly impactful. So we, wherever possible, try to get board observer seats, although we, like many, walk softly, carry a big stick. Our check size is small, but it can be catalytic, and we believe we can make many, many ripples. The other thing that ACS, has is the intramural capabilities. We do not sort of operate like a contract research organization, but there is a host of ongoing research that is being conducted at the American Cancer Society that could be tremendously enabling for our portfolio companies. And so we try to facilitate those conversations either in combination with our investment decision making or completely as a standalone, and they may then be able to explore access to our data sets, our tissue banks, and some of our advisors in that way.
Yeah, highly valuable, all of those. Fantastic. We have a question coming in from the audience. Talal Kir is asking, what is your target for philanthropists? How large and how small can a donor be?
So this is uncharted territory for us as American Cancer Society, because even though, in our glory days, we were over $1 billion of fundraising revenue. After COVID, that number is a little bit more than half, just because we did take some hits in terms of the grassroots fundraising, and then also had to make operational cuts. In this impact investing space, we know that there are other venture philanthropy models out there that are purely donor funded, and the donor base tends to be the high net worth individual who, really understands and appreciates this model. So while I would not want to turn anyone away, our minimum donor level is in the $500,000 to 1 million range. And of course, we are just so flattered to be approached by impact investors who are passionate about cancer, but maybe at a thematic level, and maybe they're particularly interested in access innovation. So digital technologies that will help patients access and afford cancer care, or interested in inclusive innovation, meaning, companies that have more diverse leadership, or companies that are addressing, truly marginalized populations. So that is where BrightEdge is currently very much interested in hearing from impact investors who can be foundational and help us set up and create new products and be catalysts for change. And this is, again, what's so exciting. It is frontier tech and frontier investing from that standpoint, because there are not a lot of models. We actually learn a lot from our environmental and renewable energy colleagues, because healthcare is sort of a few steps behind on the ESG front because we're more S than we are E. But that day's coming, and we really appreciate all of the pioneering work that they've done.
Great, thank you. And I think Sayuri has a question.
Yeah, I guess I'm just using the hand raising. And if any of you up there in the audience, if you feel like you want to ask your question directly, you can do that as well. So Alice, my question is that this is a new model for ACS, and there are a few other large NGOs I'm aware of that is trying out this impact investing model, including CARE and Mercy Court. What do you think other global nonprofit should do when they think about impact investing, adding that? Can you give us some your comments and your thoughts as to how it applies to some of these large nonprofits that's being around?
So full disclaimer, because I came to American Cancer Society as a volunteer. So I was already in love with the mission. And I know, groups like ours, we are impact at the core. It's a lot easier to be a financial organization and say, hey, we're going to throw out this product that's impact labeled. But when you are starting from a place of impact as your deliverable, and the model is actually one of a philanthropy, meaning you're talking negative returns, to go all the way to the impact investing that we're talking about, we've spent 45 minutes talking about, it requires tremendous education internally about what that means. Plus, the field is changing so quickly. So we've often in fundraising used the term invest in research, but what we mean is grant, and we will then grant back out. And so this concept of one, a more investment mindset, pay for performance for even philanthropic donations is when you can't assume everybody is following, and there are other vehicles now, to be able to, as a nonprofit, be both a service provider and an intermediary for things like social finance, social bonds, and other social finance vehicles. Then the second piece is truly, impact investing and harnessing market-based forces to deliver returns, whether those are returns on impact or financial returns, and really, having conversations about what is the problem you're trying to solve. And that's where we're adopting, more standardized language around what is the technology development objective? Is it R&D translating to commercialization? Is it last mile technology? Is it because it's underfunded because of lack of demonstrated profitability? What is the sort of technology development or market, based gap that you're trying to solve? And then what are the financing and investment opportunities that are available? And those may be in the form of private startup companies, they may be in the form of infrastructure, they may be in the form of other financial products. And then what is the role of the nonprofit? What is your appetite for risk? And then finally, what would be the, the funding mechanism for that to happen? And then you can even say, hey, take the mirror and shine it on yourself. And are you living your values as a philanthropy in the way that you invest, your endowment, your investment portfolio, all of the things that you have control over? Are you an impact investor? But what I love is that BrightEdge in its current model, being part of the American Cancer Society, we can say with confidence that, we are an attractive impact investment. If you want to fight cancer and you believe in the American Cancer Society, we are an attractive impact investment. Through our investment thesis and philosophy and values, we are an intentional impact investor and that, you know, combined, we can be a catalyst for impact innovation.
Yeah, wonderful, thank you. And we have a question coming in from the audience. Stephen Larkey is asking, assuming a good return on your early investments, do you anticipate plowing all of the money into future investments, or do you expect to return some of that to ACS for the general American Cancer Society mission?
Yeah. I mean, so today, because we were incubated by the Society, we are still growing the fund, and we anticipate it will be an evergreen fund until we can reach a certain threshold. That threshold has not yet been determined. And part of that is both in terms of the sort of the peer group from a life science investing perspective, as well as our ability to actually make larger investments, more investments. So we have to model that out. But our goal will be to ultimately grant returns back to the Society. That is where this initiative was born, was in diversifying and creating alternative sources of income for the Society.
Okay, great, perfect. And we have a question, which is the ACS and BrightEdge totally focused on the US? Are there any foreign corporations?
So the American Cancer Society, while most of our work is US based, we are not limited to the US. So much of what we've done, in fact, some of our advocacy with USAID on cervical cancer and HPV vaccination, that has been, you know, across the world. We are represented in many multilateral, you know, forums. So UN Anti-Tobacco Day, you know, so their cancer is not limited to just the US. Today, BrightEdge, most of our investments are US based, just because that is our investor network that we operate in. And one of the things that I should also mention is an emerging space for us in terms of deal flow, and really, you know, this continuum of cancer research investment by the Society is in supporting and hosting ACS affiliated researchers and institutions. And that's something that surprisingly we've not yet done. So we are currently in the process of evaluating all of our grantee databases to see what are the companies that have been formed by ACS enablement. That might open up, you know, new opportunities for us. We just we don't know, but we're very optimistic.
Amazing. And I see we're almost at the top of the hour. So I would love to ask a personal question almost. Of the solutions that you're looking at right now for BrightEdge, the investment opportunities, what sector gets you personally most excited?
Oh my goodness. You know, I still love the novel, breakthrough, cutting edge science, although it is very hard to diligence, to be honest. But I have to say, it's not so much the opportunities that are coming in, it's continuing to test and refine the model of BrightEdge. And we have only scraped the surface in terms of access innovation, as I described. You know, some of these opportunities to not just generate market awareness, but really begin focusing innovation towards a health equity agenda, but doing it in a way that is familiar and comfortable and known amongst the investment and the innovation community. I think that's the most exciting, right? Because how many of us, and I think some of us are on the call who come from more of the volunteer, pure philanthropy, charity, fundraising side, you know, how many of us know that there are individuals, institutions that have become successful because of innovation, you know, and who then, when we approach to give back and invest in the community, they won't, you know, when we're asking for purely a donation. But to do it in this way, for it to be a sustaining way of supporting an amazing mission and organization, that gets me the most excited. And that's actually why I was so delighted to be invited to help relaunch BrightEdge. I was already considering, as Sayuri knows, you know, founding my own company, my own B Corp, or my own nonprofit, and I couldn't decide. but this really allows us to do all of those things combined, and do it with the sort of trusted, legacy, historical track record of success that the American Cancer Society has.
It's very inspiring. And so Yuri, do you have any last
Yeah.
remarks for us?
Yeah, Alice, I'm so excited about your journey, and it's really good to see how impact investing is evolving from something that's a niche to something that is being seen as a great vehicle, even for global nonprofits such as American Cancer Society. So, being that impact it drives investment, financial return, and we can pour all that back. I think this is just such a great model and so exciting. So I really want to see where it goes. So thank you so much, Alice, for sharing your story.
Thank
And
you.
Thank you so much for taking the time with us today. It's
Yeah.
great.
Absolutely.
Great to hear
No,
what you're up to.
and this community is so amazing. And I will say that it is hard to find these models, right? Where you can match mission, financial, but also the operating model is one that you can really get behind and be passionate about. But I will say that many of us have to live these two separate lives for a period of time, right? Where you're doing things in the business world and then you're doing things in the impact world. And the best way to continue to bring them closer together is to actually explore them almost, separately. Like I volunteered for many years in order to understand the nonprofit impact social sector. And meanwhile, I was working in industry, and I would just encourage everyone on the line who is still in, a career exploration or a journey phase to do just that. To set goals for yourself on both fronts, and eventually you'll be the one who brings the two together.
Fantastic. Thank you so much.
Thank
And
you.
we'll connect again soon. Bye, everybody.
You.
Bye all. See you soon.